Welcome to the module on biological emergencies. By the end of this module, you will be able to explain biological disasters, describe types of biological disasters, explain the precautionary measures during biological disasters, list the do's and don'ts for diarrheal group of diseases, list the safety measures to be followed for fighting respiratory group of diseases, list the do's and don'ts for mosquito-borne diseases. Identify the essential components of an emergency kit for biological disasters. Understand the role of volunteers in biological disaster situations. Let us begin by understanding what is meant by biological disasters. We all remember the COVID-19 pandemic that swept across the globe, affecting millions of lives. It required a combined effort to combat its spread. Do you remember the safety measures and key messages conveyed worldwide to protect ourselves? Given here are some of the safety measures that were prescribed during COVID-19. These actions were part of a broader health communication strategy aimed at preventing the spread of the virus. COVID-19 was a biological outbreak which caused a biological disaster situation worldwide. Let's now learn about the concept of biological disasters. A biological disaster refers to a situation in which a biological agent, such as a virus or bacteria, poses a significant threat to public health. These disasters often require swift and coordinated responses to mitigate their impact. As we've seen with COVID-19, these outbreaks can spread rapidly, affecting individuals and communities. They emphasize the importance of preparedness, timely communication, and effective strategies to minimize harm. Biological disasters are phenomena of organic origin which may be transmitted by biological vectors. These include exposure to pathogenic microorganisms, toxins, and bioactive substances. The impact of biological disaster includes loss of lives, injury, illness or other health impacts, loss of livelihoods and services, social and economic disruption. Examples of biological disasters include outbreaks of epidemics, plant or animal contagion, and insect infestation. Now that we have a better understanding of what biological disasters are, let us learn about the types of biological disasters. Biological disasters may be in the form of epidemic or pandemic. Click on each icon to know more. Epidemics affect a disproportionately large number of individuals within a population, community or region at the same time. Cholera, plague, Japanese encephalitis or acute encephalitis syndrome are some of the epidemics. Pandemic is an epidemic that spreads across a large region, that is, a continent, or even worldwide. Influenza H1N1 or swine flu, SARS-CoV, Ebola are a few examples of existing, emerging or re-emerging diseases and pestilence. Let's now learn about the preventive measures we should take during biological disasters. Given here are a few preventive measures. Maintain personal cleanliness. Take bath daily. Don't grow long nails. Wear clean clothes. Follow hand hygiene. Wash hands with soap and water before preparing food, before eating, after passing stool, coughing or sneezing. Eat nutritious and balanced food to increase immunity. Prevent overcrowding. Maintain proper ventilation. Protect from extreme hot and cold weather. Be observant for any poor health conditions in the neighborhood. Subscribe to a medical insurance plan. Take a first aid and cardiopulmonary resuscitation or CPR training. As discussed, hand wash is one of the fundamental preventive measures during biological disasters. Proper hand washing is a crucial practice for maintaining good hygiene and preventing the spread of germs. Let's learn about proper hand washing technique. Follow 7 simple steps to ensure effective hand washing. Wet your hands with clean running water. Use soap or liquid hand wash and lather by rubbing your hands together, then rub the palms and fingers, rub the back of hands, rub fingers and knuckles, rub the thumbs, rub fingertips and under your nails, rub your wrists and wash with clean running water. Remember to wash your hands for at least 20 seconds, about the time it takes to sing Happy Birthday twice. This thorough hand washing routine helps protect you and those around you from illnesses and promotes a healthier environment. Let us next learn about precautions to be taken to avoid diseases like diarrhea, cholera, etc. Let us look at some of the do's and don'ts to avoid diarrheal group of diseases including cholera. To deal with diarrheal group of diseases, you should maintain hand hygiene consistently. Promote safe water consumption from a disinfected source, including the use of bleaching powder in community wells and hand pumps, if available. In emergencies, consume boiled potable water that has been boiled for at least 15 minutes and use it on the same day. Follow the 7 steps of hand washing for thorough hygiene. Encourage water storage in narrow-mouthed containers that are kept covered. Ensure thorough cooking of meat, poultry, eggs and seafood until they get steaming hot. Verify the safety of cooked meat and poultry, checking for discoloration or foul odors, and ensure intact eggshells. When food is not consumed immediately, reheat it to make it steaming hot before serving. Increase fluid intake promptly when experiencing diarrhea. Drink ORS solution or a homemade mixture of 5 grams or 1 teaspoon of table salt and 20 grams or 4 teaspoons of sugar dissolved in 1 liter of drinking water. Encourage the consumption of potassium-rich bananas. Continue feeding children during illness, including breastfeeding if applicable. Refer diarrhea cases to the nearest health facility when child is irritable, restless, lethargic or unconscious, eating or drinking poorly, there is marked thirst or there is fever or blood in the stool. Next, let us learn about things we should not do. If you are suffering from diarrheal group of diseases, you should not drink water from unsafe sources, eat uncooked food, leave cooked food at room temperature longer than 2 hours, consume pre-cut fruits from vendors, do not defecate in open area and do not allow rats and houseflies in your house. Now, let us learn about various measures to fight against respiratory diseases like tuberculosis, influenza, chickenpox and meningitis. The following safety measures must be followed to fight respiratory group of diseases. Avoid close contact with individuals who show signs of respiratory illness. Individuals who are unwell must remain at home and avoid public spaces, schools, offices, or the community for at least 24 hours after symptoms subside. Those sick at home should maintain a distance from others. Practice respiratory hygiene and cough etiquette by covering the mouth or nose with a tissue when coughing or sneezing and disposing of tissues in dustbins. Maintain hand hygiene by frequently washing hands with soap and water, using alcohol-based sanitizers or antiseptic hand wash, and drying your hands thoroughly using disposable tissue, paper, or a towel. In suspected or confirmed influenza cases, caregivers in home care settings, along with close family contacts, should wear a standard and certified triple-layer surgical mask, prioritize adequate sleep, physical activity, stress management, fluid intake, and consumption of nutritious food, and refrain from smoking. Individuals experiencing breathing difficulties or shortness of breath should urgently seek medical attention and report to the nearest hospital. If sick individuals need to venture into the community, for example, for medical care, they should wear a face mask or use a tissue to cover coughs and sneezes, reducing the risk of spreading infection, and ensure immunization status is up to date according to the National Universal Immunization Program. Let us now learn about some of the do's and don'ts in case of mosquito-borne diseases like malaria, dengue, filaria, and chikungunya. Drag the mosquito to each card to know more. Embrace the sundown sleeves down approach by wearing clothing that covers arms and legs. Eliminate water pools on the ground and other areas to prevent the breeding of malaria-carrying mosquitoes. Ensure water containers and tanks are emptied at least once a week. Regularly drain water from coolers to prevent mosquito breeding. Securely cover and seal any septic tanks to prevent mosquito access. Prioritize the use of mosquito nets, especially insecticide-treated bed nets or ITBN. Apply insect repellents before sleeping to effectively repel mosquitoes. Do not encourage children to wear shorts and half-sleeved clothing while going out. Do not allow water to stagnate. Do not allow discarded items such as tires, tubes, empty coconut shells, household items, and objects to pile up in open wherein water may collect. Do not bathe in village ponds where cattle also take bath. It is important to maintain an emergency kit which will be useful during biological disasters. Let's next learn about what should be included in the kit. The emergency kit should have oral rehydration solution or ORS sachets, paracetamol tablets, anti-diarrhea tablets, and antispasmodic tablets. During biological emergencies, volunteers can help in many ways. Let's learn about the different roles a volunteer can play. Volunteers can help in circulating warnings to people, identifying and supporting authorities to manage possible sources of toxic contamination, educating people on safety measures to be taken during biological disasters, and moving people to safer places if evacuation is required. Volunteers should also be vigilant of any activity that may cause spread and bring it to the notice of authorities. With this, we have come to the end of the module. Let's recollect the key points discussed in the module. We have learnt that biological disasters stem from biological vectors and involve pathogens, toxins, and bioactive substances, leading to health impacts and economic disruption. Biological disasters can be epidemic or pandemic in nature. Preparedness measures include creating a family disaster plan, maintaining hygiene, promoting hand washing, ensuring balanced nutrition, and receiving immunizations while preventing overcrowding and ensuring proper ventilation. For diarrheal diseases like cholera, individuals should practice hygiene, consume safe water, boil water, cook food thoroughly, use oral rehydration solution (ORS), and avoid unsafe water and uncooked food. In the case of respiratory diseases such as tuberculosis and influenza, precautions include avoiding close contact with sick individuals, staying home when sick, wearing masks, practicing respiratory hygiene, and seeking medical help for breathing issues. Mosquito-borne diseases like malaria and dengue require wearing protective clothing, eliminating stagnant water sources, using repellents and mosquito nets, and seeking medical advice when necessary. It's essential to avoid unclean water and uncooked food, prevent leaving cooked food out, discourage water stagnation, and avoid close contact with sick individuals. An emergency kit should include essentials like oral rehydration solution, ORS, paracetamol for fever, and anti-diarrheal and antispasmodic medications for gastrointestinal issues. Now, it is time to check your understanding of the topic. This is an evaluation exercise. All questions are equally weighted. You need to score at least 60% to pass the test. Read the questions carefully and select the appropriate options. Congratulations!